Good morning, everyone. Thanks for joining. My name is Rochelle Trigueros, and thank you today for joining the Bay Area Council's next installment of Bay Area Impact COVID-19, where we speak with business leaders, elected officials, economists, and other experts on the wide-reaching impacts of our global health crisis. As you know, COVID-19 cases are unfortunately on the rise again, prompting Governor Newsom and many other local officials to halt and roll back the reopening of California. Today, we're joined by four great panelists to discuss some of the cutting-edge solutions that companies have come up with to help keep us safe and healthy during these trying times. So I want to thank our panelists for being here today. We have today with us Ryan Pletka, President of Innovation and Strategy with Black & Veatch. Ryan is a founding member of Black & Veatch's Growth Accelerator team, whose mission is to accelerate the transformation to sustainable infrastructure. Ed White, Chairman, CEO, and owner of Field to Base. Ed White is the chairman and of the board for Field to Base, a full-service software company that develops field service automation and mobile form solutions to help eliminate paper from your business. And Chris Chibara, CTO and co-founder of Athena Securities. Athena's mission is to use AI to help prevent crime, but they have applied their technology in security to help fight COVID-19, and we'll hear more about that later. Tim Wagner, West Lead for Accenture Ventures and North America Open Innovation. With over 15 years of experience driving global product and market strategies for high-growth startups, Tim collaborates with enterprise-ready startups, top-tier VCs, accelerators, R&D centers, and others, based out of Accenture's San Francisco Innovation Hub in the heart of Silicon Valley. I want to thank all our panelists for being here today. So we're going to kick off today's webinar with some opening remarks from our panels and the interesting innovations that they're working on. But we want to spend the majority of time on questions from you all. Please note the Q&A box at the bottom of your screen, and I'll do my best to get to as many of your questions as possible. If you would also like us to recognize the company, please type that into the box as well. Thank you. So we're going to kick off starting with Ryan. During these challenging times, we often see innovation take off. Ryan, can you talk about how Black & Veatch is investing in some of these innovative solutions through your Accelerator program?
Absolutely. Good morning, everybody. It's a pleasure to be here. I work at Black & Veatch. Some of you probably have heard of our company, but all of you rely on our company. We design and build basic infrastructure around the world. So the water you're drinking, the energy you're using, the data centers you watch this video call through, communications facilities, all those things are products that we help our clients bring to the public. So the whole sector is really, we think of as critical infrastructure, is certainly one of these areas of the economy that is identified as essential. And throughout, we've been having to keep our employees and clients safe and healthy throughout the COVID cycle. And we have offices all over the world, including in Asia. So going back to January in China and Hong Kong was where we first started to deal with the pandemic directly. And I'm in the innovation team for the company. We're about a $4 billion a year company. So we have a decent sized innovation team that's really looking out to kind of, before this, really sort of what's the next generation of infrastructure the world's going to need. So things like, it's really like, some of it's pretty far out in terms of flying cars, autonomous vehicles, new types of foods and that sort of thing. When COVID really became real for us, while we do some things in public health and healthcare, we don't do a lot in that area. We felt a little bit helpless, I think, as like maybe many people do. But from an innovation standpoint, I think problems are really what feed an innovator. And we launched back in late March a COVID Solutions Accelerator program. And so that was an open call for startups or established companies to identify their emerging technologies and ways that they could, things that they thought that they could do to help and how we might combine with them. So the call was really looking for innovative new things and how do you use the capabilities of a company like Black & Veatch to help bring those to market as fast as possible. We had over 300 companies apply across many different sort of types of sectors, such as disinfection technologies, testing technologies, tracing, contact tracing, all sorts of things. And we're just kicked off the program this week. We picked 18 of those companies to work with. Some of them we've actually worked with for quite a long time, like Field to Base, Ed White, and others are brand new to us. So it's very exciting I feel really lucky to be in this field to sort of get this glimpse of what's coming and sort of the innovations that not only can help us get through this pandemic, but just make us a better, more resilient society and going forward. So lots of new cool things on the horizon, and looking forward to talking more about those today.
Great, thanks so much, Ryan. So next I'm going to turn us over to Ed. You have one of these new innovative solutions that Ryan is talking about. Could you tell us about Cooperate and how does it work? What does it do? What's the problem it's seeking to solve?
I'd be delighted to, and good morning to everyone. I'm actually on the East Coast. I'm based out of Raleigh, North Carolina, and really at the coast of North Carolina at this point in time. Field to Base is a company based in Raleigh, North Carolina, near the Research Triangle Park, founded in 2003. And the company really provides a platform that allows customers in a variety of sectors to build digital forms for mobile workforce automation. We do a lot of work in construction, engineering, healthcare, electric gas utilities, field services, et cetera. As Ryan mentioned, we worked with Black & Veatch on a lot of projects over the last several years. And one of the items that came up not too long ago was the idea of how do you get 18,000 employees back to work in a healthy and a safety mode worldwide. And so we spent the last 2 months building a solution on the underlying field-based technology and branded it Cooperate. And so what Cooperate does, it's really built around the idea of a boarding pass that will allow users to create questions that they want to do for self-declaration, to pick up test results if you get tested for COVID-19. And then we did automation through workflow that says, okay, if you have certain conditions, you may be able to get a green boarding pass to go to work. And that means you're cleared medically, but you may still need to do things like PPE requirements going into a facility. You may need temperature checks and so forth. But it's really a two-way communications using that mobile technology that runs on mobile devices with them and with your employees or visitors or contractors or whoever there. There's so much around this that's going on right now, and it's really the ability to do self-declarations on a daily basis that you need. Conditions change every day, as we know. You get tested, and that may mean you're good today, but then you get exposed tonight, so you may need to do another self-declaration tomorrow, but your conditions could really change there. Another part that we're doing is another part of the software is really checking in and out of the sites. And we're doing work around the area of location access tracing, if you will, not proximity, but really knowing the idea of when you checked into an office or a location, when you checked out. And that gives us the ability then through our data analytics platform to go back and see where have you been over a period of time, but more importantly, to identify everyone who may have been in those locations with you at that time, if someone was infected. And right now, a lot of the work is going around with interfaces directly with the testing agencies like Quest or LabCorp and so forth. Very high-speed temperature scanners. We're working with a product that Black & Veatch built called, it's a mobile health unit, essentially. It goes in front of hospitals or places where you need to do ongoing screening and testing. And so we're using Cooperate within that platforms as well. And right now, our focus is very much around critical infrastructure, medical facilities, hospitals, education, and a lot of others where you're trying to get people back to work. And we're up and running with it now, by the way. Okay.
That's great. Very exciting work. Next, we have Tim. Most of us are familiar with Accenture, but can you tell us a little bit about Accenture Ventures and how your organization has pivoted in the face of COVID-19?
Sure, happy to. So for those of you who don't know, Accenture Ventures and our open innovation group is the part of Accenture that is really helping our clients efficiently find the most relevant high ROI startups and scale that emerging technology for whatever their pressing problems are. So we do this through both a partnering perspective as well as strategic investment. So kind of have a double-barreled approach. So, we all know COVID-19 has created a lot of serious and complex challenges. Our clientele are, the biggest companies and governments around the world. And, that's something that, we're really engaged on. Like, how do you move a whole workforce to remote work for the first time overnight? That's a huge challenge. Technology obviously is going to play a huge role in that. Testing, contact tracing, for governments, supply chain disruptions, cost reduction measures. How do you create new revenue? All these things, like how do you generally keep the lights on? How do you keep your business sustainable while protecting your employees and customers? So these are things, I've, really been marinating the last 4 or 5 months. Our whole team has really been focused in on that. And I think we're starting from a really great base point because Accenture has 500,000 employees. And because most of our employees are really working on our client sites, like we've already been a remote first company in a way. So we know how to do this. So for us, I think it was a lot less disruptive than say other companies. So it makes us really well positioned to actually advise others because this is our reality, what we've already been doing for many years. And so we've been using the technology. We were sort of the guinea pig. So we're coming from a really strong place and actually helping guide people on what that means. But also, obviously, pandemic is creating, some new challenges that we need to understand how to, leverage existing technology across the board. So this is, I think, where the ecosystem is really important. Obviously, there's all the big natural players that we're really partnering with closely, like Microsoft and Google and others. But the reality is those big players, the usual suspects of tech companies, they don't always have something ready-made to address these problems, actually. And so this is where I think startups can really play in a strong way because it's a level playing field basically. But at the same time, is like our clients don't necessarily, they have a great urgency to get this right and fast, which means they don't necessarily want to be prototyping. So I think that's where pivot is really the best word because it's like, how do you take technology that's either exact fit or very, very close use case, something that's already been proven, it's already out there being used. And how do you actually just bring that to a new use case? Kind of put a point in a different direction. So that's really what we've been looking at, within our ventures and open innovation team is what are the technologies that we know? What are the startups we engage with that are really mature in their business and their technology, and they've already scaled at a reasonable amount in other places for organizations at the size that our clients are, and how do we actually bring them into the marketplace? So that's one part of the pivot. But the other part is there is no magic bullet here. There's many technologies that we need to stitch together to really create this powerful, like interlocking end-to-end solutions. You can't be piecemeal because, it's especially in terms of safety, it's really the weakest link in that is going to be what creates problems and reduces the confidence in folks. So by actually bringing together all these different technologies and painting a larger picture, it gives a lot of confidence. So, whether you're talking about employees returning to the office or customers going to a retail store or passenger going to an airport or, other transit hub or, citizens engaging with hospitals or government. These are all things that we need to figure out. And we've been very active in doing that. We're many projects that we're working on to do this. And we're really excited by some of the emerging technology companies here. To us, this is really accelerating a lot of trends that we've been seeing for a long time. I mean, one of our big kind of taglines is that I've been kind of pivoting to the new. This is before the pandemic. So, what we're seeing is a lot of those things that, we've been talking about and working on for many years is just more urgent now. So, you're going to hear from a little bit from Athena Securities. That's, one of the companies, we've been working with. It's a great startup. They're really at, the right company, the right tech, the right maturity to do this. And they're really pivoting in a very interesting way. So I'll let Chris talk a little bit more about it. I don't want to steal his thunder.
Great, thank you. But that tees us up perfectly to turn it over to Chris. Chris, I'm glad to see you're leading by example by wearing your mask. But let's turn it over to, talking about Athena Securities, who's a really great example of repurposing, leveraging existing technology to meet an immediate need.
Sure thing, thank you. Welcome everybody. This is Chris Jabara, CTO, co-founder here of Athena Security. So what we've done was we took our platform that was originally a gun detection platform that detected weapons, both out and concealed. And on the concealed side, we use thermal imaging technologies. We sold the product to government, the public sector, and then COVID hit, and we saw big wave coming. We said, why don't we just convert this technology to detect temperature, right? When COVID hit, so we took that same technology, converted it, and now we're selling this to schools, businesses everywhere, hospitals, to detect people's temperatures. It's a great technology. It's a pure alert platform. Along with it, from the gun technology platform that we had, it's able to actually, each station, if you look at like handheld units, people are getting infected because they're actually taking a handheld unit and scanning each person manually, and that obviously you can infect every person that person scans if they're infected, and then vice versa. That person can get infected if one of the people that they're scanning is infected. So this technology automates all that process for them. You don't have to have someone standing there. You can be in another building practically if you wanted to and receive the alerts, totally in a different location.
Great, thank you. And what was that process like of, pivoting your sort of business model in a sense?
Yeah, it was pretty intense. I mean, in a month, we just changed everything. What was it like? To me, it was amazing. I mean, it was a lot of work, obviously a lot of long hours, but we did it. And we're here today.
Great. And would there be any advice that you were to give to other companies sort of in your same position?
Sure. I mean, if something like this hits, you want to be, agile. You want to be, able to change and don't be stuck in your ways. And, what customers need is what you should be doing. So that's, basically what we did. The customers needed this, and so we converted.
That's great. And we do have a question coming in from our audience to you, Chris. What is the price and accuracy characteristics of the temperature sensing tool? That's a question from UC Davis from Hemnet.
Sure thing. What was the first part of that question? You said accuracy and what?
And price.
Oh, price. Okay, sure. So the accuracy is 0.3 degrees Celsius in accuracy. And the price ranges depending on your sector and what software features that you technically need, but it's around $20,000 per unit.
Great, thank you. And we have another question coming in from Sylvia Kwan from our audience. How does it work? Is it mounted on a surface or is it handheld?
Sure, so it mounts to the wall or it could be on a tripod.
Great, thank you. So speaking of really exciting cutting edge tools that are emerging, I'm going to turn it back over to Ryan to talk about, you said that you have approved, I think, 18 candidates for your Accelerator program. So we're curious about, what is the most exciting, most cutting edge or radical ideas that you're seeing?
Right. Yeah, it was a great process to go through. Like I said, there was about 300 companies. So we had this ability to look at solutions from really all over the world. And we're working with companies all over the world. And maybe the way to think about it, just to build off some things that other people said, it's about the integration of some of these technologies. So let's maybe just think about you're sending your kid back to school and you want to know that they are not only going to get a great education, but they're going to be in the safest possible place they could be. So I'm a parent of 2 child. There's a lot of anxiety about sending your kids out of your house for any reason, but imagine, these times. So so the connection of all these things that I really think makes for a powerful solution. So Ed referred to the system we developed. It's called Rapid Modular Health Systems, and it's really based on a shipping container rather than, you see a lot of tents for screening. So imagine going through something that's climate controlled, where we can control the air in there. We can clean all the surfaces very easily. You can secure it. You go through that as a portal. Everybody that's going to go to a given site has to go through this thing. And then they do temperature screening, similar to what you talked about. There's rapid tests now becoming available. And the Covaporate system that Ed referred to now becomes a way where that data lives with that person through a mobile device. They use that to scan their entry into the facility. A number of companies in our accelerator program are also working on social distance compliance technologies and tracing technologies, very low cost wearables on the order of like $10 to $20. So you have something you can, like a lanyard attached to a lanyard or clipped to your belt. It's independent of a mobile phone, which may be really important for the industries we work in, a lot of field service, construction, but also students. And so that's now tracking making sure people are 6 feet away all day. And then a whole category of thing that I'm really interested in is really neat is really environmental sensing. So it's very expensive right now to test everybody, of course. But there's emerging technologies that we're working with where you can test the air and you can test clean water, you can test wastewater. So COVID has been found in all of those things. And rather than testing 1,000 people at a meatpacking plant facility, if you're testing the air that's circulating in the meatpacking plant, before anybody ever comes in, verify that your air is clean, disease-free. Then as the shift goes on, test to make sure that somehow somebody didn't come slip through, and do it at the end of the day. So that sort of air checking, as well as could check for processed wastewaters, sense the technology in there. One of the companies we're working with then translates that information into a real-time, like, you walk into a restaurant and you have the health code rating A, B, C, D. Well, who knows if that's 6 months ago, a year ago, or yesterday. From a COVID perspective, you want to know it now, right? You want to know the place you're going into is as clean as it can be. And so that's what they're working on, is sort of integrating these data sources into this real-time health rating. And then finally, one that's also very interesting to me, expanding on the environmental sensing. So there's a company we're working with in India that's made a robot that can crawl around sewer systems. So an issue with testing wastewater at like a city level is you may know that there's 5% of people have it, but you don't know where. So this robot can now crawl through the sewers and help track down hot spots locally as it samples throughout that sewer system. Some really, really cool cutting edge things that are coming through that excite me.
Wow, that's amazing. And speaking to you mentioned schools, you mentioned manufacturing, processing plants. I want to talk about, these different arenas and industries that have been so deeply affected and, some say will never be the same from this global pandemic. And I want to turn it over to Ed and Tim to talk about these dramatically changed industries from, aviation, construction, manufacturing, and how technological innovations can help, with these transformations. I'll start off with Ed.
It's a very interesting time to be in business and doing anything right now. It doesn't matter, what business you're in. One of the things that we're seeing right now with all companies is trying to put together policies that will get their employees back to work safely and health and safely. But part of what they're also doing is looking at how they mitigate legal exposure and how do they mitigate some of the regulatory exposure if you look at electric, gas, utilities. And you're right, it really does vary. We have customers like Smithfield Foods, which, as you know, is huge in the meat production end of it, Tyson Foods, some others, Sanderson Farms. In those cases, you got manufacturing or meat processing facilities with a lot of people working in a very close environment. And they're the ones that are probably more at risk than people going into an office where you've got individual offices and you can stage people coming in and out. And so I think what we're going to see going forward is going to be things that really will help us to get people back into work quickly, but more importantly, identify very quickly if there is an issue there. And at the end of the day, there's tremendous legal exposure and financial exposure to everyone who gets impacted with this. Nobody really knows, totally what the outcome of it's going to be. When we first started this with Black and Beach, a lot of the thoughts were around that, this may be a 3-month, 6-month thing we're dealing with. And now most execs will tell you it may be the post 9/11, if you will. And if it's not COVID, it'll be COVID too, or it'll be something that happens down the road. But we've got to be prepared for it. And I think having the ability to get visibility, to treat, to test, and then being able to do the things we're doing today. We know a lot more today than we did 4 or 5 months ago, obviously. You're never going to eliminate it totally, but you absolutely can minimize the impact of it. And I think that's going to be key to keeping all of our businesses open, schools open, and everybody's fighting the same problem. It doesn't matter if it's North Carolina to California. We're all dealing with the same issues.
Absolutely. Tim, same question about these, different industry transformations.
Yeah, I mean, I think transformation really is the right word because, I mean, I think we're seeing multiple things. What are the common things across industries, but, how are specific industries handling this? What are the unique things related to that? And, I've been spending a lot of time with many different industries, kind of figuring out like, what does return to work look like, for example, like what is the tech stack for that? And opening public spaces, like how do we open train stations, airports and stadiums, retail stores, all these things. How do you do that safely? People are trying to think to the future. It's kind of the immediate need. And so what is that short collection of technologies that really enable that, and how do you describe how those fit together? And so like, the way we kind of see it is like Lego blocks, like, what is the highly validated technology pieces that you can assemble together that are, vetted, they've been proven to some degree, and they come from really different kind of spectrums of the maturity. You get the big tech players, but then you get some startups, and you'll have other groups that need to be kind of plugged together. And what does that actually look like? I think that's the really challenging thing right now is like for people to figure out like what is the best technology. There's so many technologies out there. So that's one thing we've really been trying to help our clients do. And we have kind of points of view on this, and we've done a lot of that curation over the last months. And many of these players we work really deeply with. So we can describe that in great detail. And if anyone's more interested, I can go down a rabbit hole in that. So feel free to reach out to me if you want to learn any more about that. But I think the thing that really clear is that, I think all the way up to the C-level, these companies, they're saying, okay, I have these urgent needs I need to solve right now, but how could we potentially get a double win here where we position ourselves for the future too? Return to work is a great example. Like, okay, how do I make my office like a safe place? My employees will feel good coming back. They'll get the benefit of working in the space, but they won't feel like they're going to catch COVID-19 while they're there. But also, we know that there's going to be multiple waves of this pandemic. I think we're already seeing this in California with starting to reverse things, and so they have to actually start thinking long term too. Is not just how do people work today with remote workforce tools, but also how do you recruit and onboard people who aren't going to come to the office. I think this is something a lot of companies have never had to deal with before, and so they have to really rethink their processes, and they do need new technology. By default, you can't do everything over Zoom. You do need some tools to help you navigate that and make sure that you get the same benefit, and also potentially find kind of new features that are really interesting and add value, and maybe even attract employees. So I think that's, we're constantly operating on this kind of two speed modes of like what's now and what's next. And I think when we can find like a sweet spot where those converge together, you can actually get a value on both of those. I think that's what really excites me. And I think what's really interesting about some of these technology companies. And I do think some of the startups that are having success now will become really big tech companies because of this kind of moment in our history, actually.
Great, thank you. Yeah, it's really interesting. The Bay Area Council is right now in a transition between offices, and so we're talking about what to implement to make sure our new office will be, as safe and healthy as possible. We have a question from Michael Lairmore to Brian and others. Can you comment on how the COVID pandemic has influenced workplace construction that is safe and still promotes social interactions important for creativity, and on food chain and innovations? This is from the Dean of UC Davis's School of Veterinary Medicine.
Great. Excellent question there. I think there's a couple themes maybe to tackle. As we were running our accelerator program about halfway through, we recognized that there was so much neat, cool things there, and we didn't want to keep it all to ourselves, particularly around the construction industry. And so we formed another program with our peers called the Next Coalition, which is specifically looking at health and safety technologies in kind of the built environment and the construction industry. So something as simple in construction where you've got typically a tool shed where multiple people are using the same tools. How do you make sure that that doesn't become a vector for construction workers, right? The interesting thing about construction is like health and safety is really a paramount value. It's not that it's not in other industries, but compared to like a movie theater, it's every single day, right? Construction crews start the morning with safety discussion. Safety is tracked, tons of training around that. So it really fit naturally with sort of like, how can we implement these technologies as quickly as possible into that? And then how do you make those sort of innovations sustaining such that, once we build a facility, now you turn over something that is going to permanently improve the health, or at least keep people safety and health inside an office building, a campus, what have you. That I would say at this moment is a bit more open. Well, all this is sort of changing very fast, right? But how we do that and how those sustaining innovations are going to take place in the market is an open question. The other thing that's I just want to respond to in your questions around creativity and collaboration. We are certainly one of those companies that went from mostly in-person offices to virtual overnight. We have about 100 offices around the world. The good thing about that is that we already had, I had already been working from home 50%. So our IT systems and everything, we were set up to do that. And the experience has been very good. We monitor productivity across the company, and it's basically unharmed. And even in the innovation space, for me, it's probably been the most innovative last 3 months of my career at this company. The question is like, one of the things we just did an employee survey, and there's things that are coming through that we had not thought about, and it's things like, how do you address the isolated person, the lonely worker? Loneliness came through as one of the key downsides of this in our survey. And like, you can have all the virtual interactions like this, but still, how are you going to really keep people connected and make sure mental health is addressed, right? So those I wish I had a great answer, but we're always looking to collaborate and looking for new solutions for those types of things as well, because it's one of the things I had not been thinking about.
Yeah, it's really definitely important. I mean, especially given that there seems to be no clear end in sight for this pandemic. And so, protecting our mental health is super important. Going back to some specific industries that will be changed, we got a question from Hans Corvey that Chris answered in our chat box, in our questions and answers box. But I wanted to, give Chris the chance to say his answer out loud on the webinar. So Chris, what system do you see as being able to test an airplane to make sure it's safe for a flyer to enter?
Sure. So I think the proper things that should be going on until everyone gets tested weekly for COVID is everyone should be temperature checked before they get on a plane, employees and passengers. And also, if possible, use disinfectant between each flight. On the plane, use UVC light. There's a difference between UVC A and B. Obviously, A and B will not kill the virus. UVC will kill the virus, but it's harmful to humans, so you just have to be careful with the technologies that you decide to use and implement. Yeah.
Absolutely. And, Sylvia Kwan has a follow-up question related to the temperature checking. Sort of in reference to these videos that we're seeing of people, refusing to wear masks and making a big scene in grocery stores and things. Do we need to have some sort of ambassador or person that's telling people, I'm sorry, your temperature is too high to be able to enter here? And do we anticipate that being another, ripe for confrontation as well?
Sure. So what we're seeing in hospitals and other places that we're in, they do have an ambassador that sits there for the first couple of weeks until everybody understands what's going on. Then they kind of don't need that person anymore once everybody understands the flow and what's happening.
Great, thank you. You broke up a little bit there, but
I basically what I said was some of the customers that we have, the hospitals that we have, and universities that we have an ambassador for the first couple of weeks while they're implementing the product and they're using it, and people are just getting used to it. So once you educate the public, everything seems to be fine after a few weeks, and you don't need to have that person there anymore.
Great. And Ed, are you seeing any of that with your passport tool?
It's interesting. The temperature is probably the one that most people are focused on, and we're working with a group of doctors out of the Philadelphia area, and a major hospital up there. They went back and looked at every patient that had COVID-19, and they found that almost 40% showed no signs of elevated temperature. So temperature is important, but I think the other things, kind of looking at CDC guidelines that go around it, is kind of the holistic approach of how you really need to evaluate whether you're at risk or not. And these protocols are evolving as well, because what we're finding that the different industries are looking at different things. We're spending a lot of time right now working with some of the universities, both public and private, and also K through 12, trying to get not only faculty and staff back to schools, but also students. And so a lot of it is around how do you do it safely, but how do you do it in a way that people are truthful in what they're reporting when we talk about self-declaration. And a lot of it's education. Part of it's educating everyone that it's in their benefit to be healthy, to keep their coworker healthy, and to keep the entity they're going to healthy as well. And somebody made a comment earlier. The sense of urgency is right now. The universities are trying to get open again for the fall semester. Hospitals have to stay open, and some people have the luxury they can continue working at home. But there's a whole mixture of things out there right now that we're dealing with.
Yeah, absolutely. So I want to pivot the conversation a little bit towards, the role of government, the regulatory environment we're in. We often hear this narrative that regulation doesn't keep up with how fast technology is moving. And I want to hear your perspectives on that and, the importance of government regulation and standards to create consistency across technologies. Why don't we start off with Tim? You're muted, Tim.
Thanks. Yeah, I think the regulatory question is a good one. All regulations that, they start out with the best intentions, but, they're not designed for every scenario. So, COVID-19 is definitely kind of stressing just everyone, government, private sector, public sector, trying to navigate this, this world. We see this in different applications, how the government's trying to address the situation. And I just think it's like a learning moment for everyone, for us to, update how we run companies and how government updates its, regulations and laws. Everyone's trying to solve this. California, Governor Newsom has always been a really forward-thinking, leader, even when he was back in the San Francisco mayor, really thinking about how do we use technology, how do we make technology procurement easier, and how do we actually streamline regulations to really maximize, public health. There's a lot of things we have to balance, like privacy is obviously a huge one, like with the HIPAA regulations, or, here in San Francisco, like, the facial recognition ban and things like that. And so, like, how do we get the best out of technology while, giving people full confidence in their health, but also, respecting, like, privacy and things like that. So, this is just a moment in history where we're going to have to evolve. There's a balance, there's a trade-off, and some of that just requires a conversation between, us, as, the people who can benefit from it, but also people who has our data, like, and I think actually this is interesting because it brings up a lot of conversations that I think, Silicon Valley has been having for a long time. I think the regulations like GDPR or the CCPA around our data privacy, are good starts to have that conversation and just think about, like, companies own our data. Well, how can we give people more agency over their data? What can we do with that from a public health perspective? And there's a lot of startups actually really working on this and trying to address it. Obviously, blockchain is, one area, particularly that identity has been really heavy on. So, we just see a convergence of multiple topics, and startups are really at the center of that conversation. And so, I think that, to me, that's something I've been really passionate about, and really great to be working with these companies, trying to work through those really hard questions, and really evolve our regulations.
Yeah, absolutely. And the privacy question is really interesting and obviously very top of mind for the public right now. So turning it back over to Ed and Chris, who are dealing with actual products interface with the public, what privacy concerns have you had, or hurdles or anything? Interested in hearing your perspectives. I'll start with Chris.
Sure thing. So obviously we deal with hospitals and other places that have to abide to HIPAA rules, and other companies have different kinds of policies dealing with privacy, of course, and everybody wants their privacy. So yeah, you have to adjust your products so you're not giving that information in the wrong way. So when you look at our temperature readings, we don't actually show the temperature on the screen. If you don't want, we have different features that hide the temperature, and we just put a checkbox or an X on the person. And as far as keeping images or video, of course, it's encrypted. We follow all the different guidelines. You have to keep people's information private. We even have a setting to delete all information, so we don't track anything or keep anything. It all depends on, of course, the customer's needs and their policies and procedures. So we have all the different features that are needed to keep everyone's information private, and everybody should, right? I mean, this is an age, everybody's really on edge, and they don't want their information in different spots, and they don't want anyone to know what they're doing or what their health has been in the past. So it's our duty to keep everyone's information private.
And also, just to add into kind of what Chris was saying too, because I know me and him have talked about this a lot, is when it comes to regulatory things, is that government is being lax in some ways in some areas right now because of just so many things in motion. But that doesn't mean the regulations that have stopped. For example, some of the stuff that Chris's company is doing, around a lot of things that are doing thermal imaging stuff, have to comply with regulations around medical devices. And so that is something that a lot of startups are jumping into this. Actually, I think they're a little bit out of their depth sometimes, because they're not thinking about the next step. I mean, it can be a solution now, but if the regulation comes back, it's going to hit them really hard. And so I think more startups need to think about that a lot. I mean, obviously, Accenture works with big companies, so we're very well versed in that, and our clients think that way. What is the regulatory implications of a given technology, both now and in the future?
Yeah, that's a really good point, Tim. And companies need to be aware of the regulations that are out there on these types of technologies, and they need to abide by them. And if everyone's not clear, the FDA did give an exception to these technologies in the U.S., but they're going to lift that exception eventually, and then you'll be doing things against the law. So you got to be really careful and follow the rules, obviously. And we are actually certified in Canada already as a medical device, and we're just waiting for the U.S. To pass us in the U.S. right now.
Let me add just a couple of comments there. One of them being that privacy is one of the biggest issues that we deal with when we're talking about something like COVID-operate. And up to this point, if you think about medical data, it's primarily between your doctors or your physicians and the testing agencies. If you think about going and getting blood tests and so forth, where employers have typically done certain things, it's been around the idea of drug testing, where you do have to do drug testing for employees. But now that we've opened up that can of worms that says employers need a certain amount of medical data to know whether you're safe from COVID-19 or not. And what we're kind of seeing is that they don't really want to see the test result, the tests themselves. They don't know what the results are. Did they test positive, negative, antibodies present? Same thing through a temperature. I agree. And it's are you above or below the threshold recommended by CDC or others? And I think as long as you kind of stay in those lanes, you probably can get by with the privacy part of it. But even then, most of the companies we're working with, their legal departments are as much involved as anybody else is. So what we really are seeing is health and safety, human resources, and legal, and everything that we're dealing with right now. And this will unfold, I'm sure, over the next few months. You got to remember we're pretty early stage in using technology to do what we're doing right now between employees and their employer that we've never had to do before. And I think we'll probably see some good stuff come out of it, and we'll probably see some things we need to change as we go forward to meet what we need to protect privacy and so forth.
Yeah, sticking with the theme of, the role of government in all this innovation and, this fast moving technology that companies are coming out with. I'm curious to know in what ways, if any, you are all interacting with government, working with local and state, maybe federal government in these ventures that you're taking on. Ryan, I'll start with you.
Yeah, it's multi-layered for sure. I mean, our kind of first concern, if you will, as a company with given our large construction workforce was understanding the impacts of shutdowns on, our projects, which we got people all over the place. And what those shutdowns really meant, were we really considered an essential workforce or essential activity or not? And Bay Area Council's been really actually a great partner on some of those activities here locally. But you've got many different, it's like a tapestry of conflicting guidance, right? So how do you interpret all that stuff? So that was kind of like the first thing. Now it's more evolved into, okay, how do we recover? How do we make our lives more resilient? How do we make sure this never happens again? So one of the ones I think will be really great if there's some government leadership on is these environmental sensing technologies, particularly wastewater sensing. So through wastewater, it's now been shown that you can detect COVID. You can correlate that, the COVID virus. You can correlate the level in the sewage with the prevalence in the population, and that it's potentially even a leading indicator. So before people show up with positive tests, before they show up in the hospital, you can start to sense things in the sewage. The challenge is, how do you deploy a network of those things that then it becomes a reliable public health data set? Who's going to pay for it? Would it be, because the wastewater agency wouldn't necessarily have any value in that data themselves, but public health agencies would. Recently, I think people know, like the city of Wuhan tested 10 million people. The cost was something like $100 to $200 million. So to put in place in California a testing network that works continuously in the wastewater system would probably be similar cost. And you can use it not just for COVID, but for other things that show up in wastewater. So that's going to require some government leadership, I think, to look into programs like that and the benefits of them and whether or not that makes sense from a public investment standpoint.
Thank you. Chris, did you want to add to that?
What was the question again?
This was about the role of government. Are you working with state and local government on, these product innovations?
Sure. We definitely work with state and local governments, and we sell to them, obviously. As far as working with them to see a better future, we haven't done much of that yet.
Great. Thinking about, the future, we've touched on themes of, resiliency. How do we make sure that, these products are what we need, obviously, right now for this urgent need, but how do we make sure that we can repurpose them for other things or use them for solutions post-pandemic? And so let's talk about that a little bit, about the, repurposing, rethinking of these products for a resilient future.
Absolutely. So what we're doing with our clients currently, it's the same technology we were using for concealed weapons. So as we're scanning for COVID, we can also scan afterwards for concealed weapons on a person, which makes the technology convert and, nothing's wasted.
Thanks. I'll turn it over to Tim.
Yeah, I think this kind of relates back to, your government question, how can, because government's spending a huge amount of money, as Ryan said, on some of these systems. And if, you can make an argument that, how can this be used in the future? I mean, I think we are laying some really great tracks, not just for COVID-19 and whoever knows how many subsequent waves, but just even for future pandemics and other things. I know we've talked about, Zika virus, Ebola, there's been multiple scares in the past. So, I think we're laying really great tracks for doing that. But I think I just think, we all know like healthcare has a lot of challenges, and, there's a lot of frustrations on many sides. And I think this is actually something, stressing our system, but it's also, I think, accelerating some of the things that we know we need to change. So like, Accenture's been working with, National Health Service in the UK to really like enable remote working, and that plugs directly into telemedicine, and we've been seeing a huge rise in telemedicine because of this. Like, how do we actually triage people more effectively and not necessarily send them to the hospital where they could get exposed to the virus, so that there's this immediate, like, structure that's, proving the thing. I mean, this is actually something we've heard a lot from, the C-level that we've talked to companies, is saying, I didn't think we could be a remote workforce. I didn't think that would work, but now I know I'm wrong. We never tested it at the scale before. And that has huge implications about the nature of work in the future. How many offices do you have? How many people need to be in office? What kind of systems you need in place? How do you do reskilling? How do you do career advancement? How do you do, recruitment? All these different things around that. And obviously on the government side, Accenture's been supporting multiple states, federal government, like countries, on many aspects of the COVID-19 response. Here in California, you've been working with Amazon and Salesforce and others on how do we develop and implement immediate and long-term solutions for the things that we're, hearing about every day. I think there's a lot of good stuff coming down the pipe, and we're not necessarily reinventing the wheel. I mean, this is something we can take the learnings from one place and bring it to another, which includes cross-industry, which I think is probably something everyone on this call has really experienced, is like seeing, kind of things jump from one industry to another in really interesting ways. And same with technology, jumping from one use case to another. And I think this is really, it is an exciting time. I mean, it's a challenging time, but I think there's a lot of necessary changes that have been needed for decades. And I think this is going to be kind of a Cambrian explosion of change, I think, when it comes to many aspects.
What I'm really excited about, and don't quote me on this, but I think I heard recently that $3 trillion a year in the US, or 15% of our GDP, is spent on healthcare. And the entire system is really set up to really be driven by sickness, right? And treating people. And I think there's an opportunity to sort of say, like, how do we incentivize people, companies, startups, to profit off of keeping people healthy? There's so much energy in people's daily lives right now about not getting sick, right? And so that paradigm shift, I know personally for me, I had no problem. I did it all the time. I would go into the office when I was had a sniffly nose or a cough, and it's probably a very selfish act, right? I won't do that again in the future. Average employer, I think, spends something like 45 cents an hour on sick leave. And so there's this enduring cost beyond this pandemic of sickness, right? So how can we transform the whole picture of, that $3 trillion and say that's a massive amount of money we take to treat people? How can we use it really to keep people healthy going forward?
I'll just add a comment on the technology, and that being that, with the ability to communicate with a lot of people very quickly. We've always done a lot of work in areas like damage assessment and so forth with hurricanes on the East Coast, earthquakes in your part of the country, and fires. But when we have catastrophic events, we need the ability to mobilize people, multiple companies, multiple contractors very quickly, be able to dispatch them out to the work sites and get things done very quickly. And so we're already in discussions of some of the work we're doing right now with the Southeast, with hurricane season coming in on us here very quickly, to use this technology to address catastrophic events like hurricanes, like a Sandy or Katrina and so forth. And, in your world, it's more earthquakes and fires, but you deal with catastrophic events as well. And we've actually done quite a bit of work with PG&E around the area of emergency response and assessment for catastrophic events like that.
Yeah, just to add on one other thing too, is that I think one of the things that's maybe been more hidden, I think general public and even some of our clients, is that entrepreneurship, like in starting startups, has become so easy. There's really a lot of rails that have been created to do that, entrepreneur programs and accelerators and incubators and all these things. And I think one of the net changes has been that we're seeing really different types of people become founders. And that's been true really for the last, 4 or 5 years. And I think that really matters because, for example, there's this, one company that, been working with Bowie Health, they're helping on the contact tracing in Massachusetts, the state of Massachusetts, which is Accenture is also supporting. And, the CEO's an MD. You didn't used to see many MDs become founders. And that's huge because they bring such a huge knowledge of like what it's like to be on the MD side, what is it like to be on the clinical side, and they know how to speak that language, and they're both the end user or buyer sometimes, and so they're actually starting companies. And I've seen many MDs actually starting companies, and it creates a lot of credibility. And I think it also really encourages also going back to the regulatory thing of creating a little bit more momentum. To change the regulatory things, because now it's not just the tech guys coming in with saying we have a solution. It's someone who's an MD, or someone who comes from public health. And I think this is a net good. And I think it's most important we see in heavily regulated industries, whether it's financial services or health, or others. I do think that's why I'm generally optimistic about change, because I do think that's going to help accelerate us to where we need to get. And it's actually going to create better solutions because they're coming from a place where they have a lot of nuance. It's really easy for us to say, like, why can't we just solve this thing? We see the problem. It seems pretty straightforward. But the thing is, we don't know all the nuances. And I think that leads to better solutions at the end of the day.
Great, thank you. We're almost out of time. We just have a couple more minutes, unfortunately, but I want to give you each a chance to provide any closing comments, any takeaway points that you want to provide the audience before we depart. Ryan, I'll start with you.
Yeah, we're, what I've been impressed about is sort of in the medical industry, which I'm not a participant in, is the amount of collaboration and sharing on research. We are very similar on these innovations. So please feel free to reach out to me. We got multiple ways that we're collaborating with people on our accelerator. We have 30 or 40 partners in terms of people in industry, government, what have you. In our next coalition, we're directly collaborating with other partners. And so we know that this is not just as Tim just said, it's like nobody has the one solution. So please feel free to reach out to me via LinkedIn or however, and I'd love to collaborate with people.
Thanks. Ed?
Unmuted. Okay, we're unmuted there now.
Yeah, we can hear you.
Just probably the most interesting thing is how quickly companies have been able to respond to this pandemic. Most things you have a lot of advance notice to prepare for and so forth, but this one is one that we absolutely did not. And so I've been amazed that what we've done, worked with Black & Veatch to put something together within a couple of months. Will probably take 6 months to a year to spec out and do something like that. And it's not only what we've done, but other companies as well. And the other one, I think, is the willingness for people to work together. Many companies are competing in many areas, but seeing unbelievable cooperation, if you will, trying to address this issue because they're all impacted by it. And I think those are the two things that will probably put us way ahead in the world as far as solving this problem.
Great, thank you. Chris?
Sure. My takeaway is I think we need to do a better job educating everybody. I think if we educate the people, a lot of our problems would go away. A lot of people aren't wearing masks. A lot of people aren't following guidelines. But I think if we educate the people why they have to be doing this, I think this can clear up a lot faster than it is currently.
Absolutely. And Tim?
Thanks. I think one of the common things that I've just been saying this whole thing is that everyone's doing their best to try to solve these things. We're all struggling with a lot of different things. Working from home is not easy always. These are complicated problems, and there's a lot of option overload, because there's many problems to solve and there's many different ways to solve it. And we tend to reach for the things that we know. And, I definitely encourage people to think beyond what we know, because sometimes the best solution is the ones that we're not aware of. But navigating that is really, tough, and so I'm happy to, be a sounding board and answer more questions, because, Accenture just seeing, we're getting exposed to so many different conversations on the private public sector, every industry, And so we're seeing a lot of things and like kind of learning a lot of lessons at high speed, and happy to share those out. And same on the ecosystem side, we're engaging with so many technology companies, and we've done a lot of work to try to really narrow down to what really matters. What are the ones we really should be paying attention? So it kind of helps sort through that noise. So, if any of you kind of really also kind of struggling with that, or, looking for help in that, always feel free to reach out. I'm happy to share what we're seeing and what we've learned.
Great. I want to thank you all so much for participating today. It's been really interesting. These, innovative solutions and ideas are very exciting, and, provide us the, peace of mind, at least even, of, how to get back to our somewhat normal lives during these really scary times. So I want to thank you all for participating, and thank you to the audience for joining us today. Take care.
Thank you.
Thanks, Joe.
Thanks, everybody.